The purpose of MAPS is a collaboration of multiple stakeholders representing insurers, providers, accreditors, the Department of Health, Stratus Health, to come together to provide care that is as safe as possible. And MAPS goals are kind of fourfold. They're to help with coordinated transitions, to engage and inform patients, and to ensure transparency, and also to provide learning and education for healthcare providers in Minnesota to allow them to provide the safest care possible. About 3 years ago, and I was sitting back there thinking to myself, I can't believe it's been 3 years that we've been working on this, and to have it come to this point where there's a room of 200 people, it's just amazing to me, because I have to admit, when this first started in 2009, there were about 12 of us sitting around in a room, kind of bouncing back and forth the idea of whether or not a collaboration can inform and standardize a way to think about culture across a community. We had some doubts whether or not that could happen. It was kind of an ambiguous topic. What is culture? What do we mean by culture? Can MAPS inform the culture of, for example, a Fairview Hospital or a Park Nicollet Clinic or a long-term care facility? And we were, we kind of bounced back and forth. No, we can't. Yes, we can. And so I wanted to just kind of provide the journey that we took. The MAPS Operations Committee commissioned an exploratory work group. It was a group of about 12 people from MDH, MMA, the Institute for Clinical Systems Improvement, Fairview Health Services, Stratus, and VHA Upper Midwest, as well as Murray Dosteth from Dosteth Consulting, and a representative from a regional treatment center, kind of talking through these issues. We decided that, this is something that we can try to codify and put into a roadmap and collate all the best practices. And we made a recommendation ultimately to the MAPS Operations Committee to do that, but I wanted to kind of let you know what we talked about while we were in those intense meetings. So the exploratory work group looked at a variety of different measurement tools. VHA Upper Midwest had done some work with the ARC Patient Safety Culture survey, and they had mapped out where they felt their gaps were in the VHA Upper Midwest system. Stratus Health had been working with rural hospitals to help them do some surveying of their culture, and had some interesting findings about where there are gaps in culture. And then ICSI had done some work around safety culture and had also developed a measurement tool to help practices identify where their gaps were. So we realized that there was an opportunity to capture data, identify gaps, and kind of codify and have a quantitative approach to looking at culture. We also, when VHA Upper Midwest measured, they found that there were gaps in kind of the justice and the teamwork and communication areas. So we knew that there were kind of there was an evidence base for all these different areas. Similarly, I think that Stratus found that there was patient and family engagement areas that needed to be addressed. And then ICSI had kind of leadership and learning, kind of the evidence base and what it takes within an organization. So we were kind of landing on some key themes across all the different efforts that were happening in Minnesota. So from there, we took those key themes and kind of started to build a framework around it. We identified that we needed to have some common form of measurement, that we needed to have some common areas that people would work on, and then we needed to have a system for improvement and remeasurement. So after that, the exploratory work group made a recommendation, as I mentioned, to the MAPS Operations Committee to have MAPS move forward, that yes, there is a role for a collaboration to help inform and identify key areas of a patient safety culture. We asked that the Operations Committee consider providing a framework, developing an evidence-based framework for facilities to use, and to look at the evidence to develop those best practices, tools, resources to help move those efforts forward. And from there, we commissioned a full work group, and Kate was one of the co-chairs of the full work group, so she's going to talk a little bit about the process that group took.
By September, we had a work group assembled and had met. As Becky said, I co-chaired it along with Nancy Kielhoffner. And as you can see from the slide, there were many organizations and many healthcare settings that were on the work group, which was important because we wanted this roadmap to resonate across all healthcare settings. The work group had two goals. The first was to develop a roadmap using best practices, emerging national standards, and building upon the good work that had happened here in Minnesota already. And secondly, that those best practices become a community standard through a statewide call to action across all healthcare settings. And also, we used the ARC definition of safety culture to help guide us. One of the first things that the work group needed to do was to determine what were going to be the building blocks for the domain. So a literature search was conducted, and this is the key article that we found. And it was a meta-analysis of over 200 journal articles written on safety culture. And what they found is what they termed subcultures that contributed to a safety culture. They were leadership, communication, teamwork, learning, patient-centered, and evidence-based. And those became the working domains for the roadmap. Next, the work group really examined each of those domains as far as how they were relevant to each healthcare setting and what were the best practices that supported those domains, because those are going to be an important part of the roadmap. About a year later, it really was. The domains were assembled into a roadmap. There were audit questions developed for each domain. And then the roadmap in that draft form was sent out to key stakeholders for review and feedback. And at the same time, the work group was gathering tools and resources for each domain. And so beginning of this year, the roadmap, or final feedback was received, and the roadmap was finalized. There are 6 domains. There are 2 other sections. Each of it has specific actions that support those sections or domain, and audit questions that help an organization to determine whether they have those specific actions in place or not, and tools and resources if they don't. And that brings us to today. And here is the roadmap. We call this the bird's eye view. It's minus the audit questions and the tools and resources. You'll see that it begins with getting started in leadership. And then there are the other domains. Today we are focusing on getting started in leadership, but Becky and I will go through the other domains and sections just to give you an idea what they entail. The communication section really focuses on structured communication processes and handoffs, and creating a culture where it's safe and expected for an individual to voice a concern. The justice culture is about hardwiring into the organization fair and just processes and practices, whether they're in the HR, clinical, or like the root cause analysis process. The teamwork section is about teamwork, training, coaching, and using tools, and is really supports a program like Team Steps.
The learning section is, Minnesota is really lucky to have adverse health reporting law for hospitals and surgical centers. But the learning section, it encourages organizations to have a robust data collection, a systematic way of collecting data on near misses and errors, and then using that data to inform any improvements that are made, and engaging leadership in soliciting information from employees and patients. And then the patient engagement section is providing avenues for patients, their families, clients, residents to provide input into quality improvement and patient safety activities, empowering patients and their families to raise concerns within your facility if they feel their care is unsafe. And then allowing or having effective disclosure processes and ensuring that patients have the tools and resources and information that they need to make decisions about their health care, to ensure that patients are health literate and that cultural competencies are met within facilities. And then finally, sustaining the overall initiative. We know that sometimes that's the hardest part, sustaining the initiative. That's continued measurement, continued use of the measures to inform any new actions that are taken, continually reviewing your plan and providing education to your providers and employees, and then celebrating your successes when you do have successes in your organization.